Hey guys, welcome to this session. Our topic is human nutrition. In our past video discussed the digestion process. We saw how the digestion takes place throughout the alimental canal. We also discussed the difference between the human digestive system and the other mammals digestive system, specifically the ruminants digestive system. So today let's discuss the common disorders and the diseases of the human digestive system. So here we're going to see the various disorders and some of the diseases that resulted from the uh, various human digestive problems. So let's start with them. These disorders and the disease of the digestive system. Specifically here, we're talking about the various diseases and the disorders that can affect the various organs of the alimental canal. Specifically, take an example: teeth, esophagus, stomach, small intestine, and the large intestine. Now, examples of these kinds of disorders and diseases they include such as the dental caries, heartburn, ulcers, constipation, and the flatulence. So all these are just some of the disorders and diseases of the digestive system. Now, we'll briefly discuss them one by one, starting with the first one, that is the dental caries. This is commonly referred to as the tooth decay, and it mainly occurs when the bacteria destroy the outer part of the tooth. So it occurs when just a bacteria enters the tooth and destroys the outer part of it. And it can also be caused by some of the causes such as poor oral hygiene, that is including poor brushing teeth habit. So person lacking a proper oral hygiene, that is brushing teeth regularly, can cause this tooth decay. And eating disorders, specifically taking an example, maybe eating foods that are too cold or too hot, or foods that have too much sugar in it, specifically for kids and children. So all this can cause the tooth decay. The second one is heartburn. This refers to the burning and the painful sensation in the esophagus. It is caused by this regurgitation of the hydrochloric acid in the stomach, which leads to the irritation of the esophagus. So the hydrochloric acid tends to flow up to the esophagus. So this leads to the irritation of this esophagus. The third one is the stomach ulcers. The stomach ulcers, this refers to the sore in the stomach lining. It is caused by erosion of the stomach wall due to the enzyme reactions. So various enzyme reactions can cause the stomach ulcers. The fourth one is the constipation. Constipation refers to the decrease in the frequency of the formation of stool. It occurs when the stool becomes dry and hard due to the excess water absorption in the colon. So excess water absorption in the colon makes the stool become very hard. So in such it leads to this constipation. The fifth one is the flatulence. Flatulence, this is caused by the excess gas in the digestive tract. It is caused by the swallowed air, this excess gas in the digestive tract. Also eating food that causes gas. Take an example: beans, cabbage, milk, and the onions. These foods, they cause gas and the poor absorptions of the carbohydrates. So let's move on to the symptoms, effects, and the control measures of these common disorders and the diseases of the human digestive system. We'll start with the dental caries. The various symptoms of these include toothache. So experiencing toothache is just a sign of this tooth decay. Also holes in the teeth, they are another side symptoms. The effects include chewing problems. You can experience chewing problems when you have this tooth decay, also swelling around the tooth, Another one is tooth loss, invisible hole in, I mean a visible hole in the tooth or teeth, pain, especially maybe at night, and the pain when you bite down. So specifically when you bite something, experiencing some kind of pain is a sign of tooth decay or dental caries. Controlling the preventive measures include as follows. The first one, that the regular brushing of teeth. So this is the first one, as a good way of controlling this tooth decay. So proper oral hygiene, that is regular brushing of teeth for at least twice daily to reduce the tooth decay. The second one is the damaged teeth can be filled with the artificial crown. So those damaged tooth or teeth, you can fix them by filling them with the artificial crown. The third one is the minimization of the intake of foods that are rich in sugar. The fourth one is avoid eating less or just very hot or cold foods. The last one, that have regular dental checkups. So this can help to control and prevent the tooth decay or the dental caries. The second one, which we're going to discuss, the stomach ulcers. The stomach ulcers, the various symptoms of it include burning pain in the stomach, nausea and the vomiting, tiredness and the weakness, also blood in the vomit or stool. While the effects include nausea, abdominal pain, bleeding, change in the stool color, heartburn, feel full fast, and the gastrointestinal this perforation and anemia. All these are just effects of the stomach ulcers. While the control and the preventive measures include as medications, avoid smoking, avoid taking alcohol, avoid eating these acidic foods. The other disorder and disease is constipation. The various symptoms of it could be lack of bowel movements for 2 or 3 days. Another one is hard stools, the urge to go for a long call even after you've just been to the toilet. All these are just symptoms of this constipation, while the effects, if it is left untreated, serious constipations can arise, such as hemorrhoids and this feature fecal implantation and the lentil collapse, as well as other related diseases that can affect the general health in the long run. The control and the preventive measures include as eat enough fiber foods. This will help the good movement of food within the alimentary canal. The second one is drink enough water. Since you have enough water to be there for proper absorption of food and the movement of this food within the alimentary canal, exercise regularly to make your body fit and to stay healthy. And the fourth one is just seek medical health, or just, I mean, seek medical help will enable and will help to prevent and control this constipation. The other uh, disorder and disease is the flatulence. The flatulence includes symptoms such as the abdominal pain, the constant urge to pass wind, excessive uh, belching, accumulation of gas in the stomach, and the various effects include as it may cause pain, clamping, bloating, and the other uncomfortable symptoms, where the controlling the preventive measures include as avoid foods that produce gas and chewing food properly, as we enable foods to run properly within the alimentary canal and smoothly throughout the alimentary canal. The last one, not least, the heartburn. The various symptoms of this include a burning pain in the chest that usually occurs after eating, and it may also occur at night. The other one, that pain that worsens when lying down or bending over, and the other one is that a bitter or acidic taste in the mouth. While the various effects include as nausea, bloating, chest pain, shortness of breath, and asthma. Last but not least, the bad breath can be also an effect of heartburn. But the control and the preventive measures include as avoid late meals, uh, using of ginger will help to kill or control this heartburn, avoid foods that trigger heartburn, eat oatmeal, apple, cider, vinegar, bananas, lean meats. Also manage your weight and quit drinking. All this can prevent and control the heartburn. So basically, guys, thank you for listening. We've discussed the various common disorders and diseases that are caused or just related to the digestive system. Thank you.